Cachexia is a complex syndrome characterized by severe weight loss, muscle wasting, and a significant decline in overall health. This condition often arises in the context of chronic diseases such as cancer, chronic obstructive pulmonary disease, heart failure, and advanced kidney disease. Unlike typical weight loss due to dieting or malnutrition, cachexia involves a multifaceted mechanism where the body's metabolism is disrupted, leading to muscle degradation and fat loss, even when caloric intake may be adequate or excess. At the core of cachexia is a complex interplay of inflammatory processes, hormonal changes, and metabolic alterations. When the body is under stress from a disease, it produces a range of inflammatory cytokines. These are signaling molecules that can influence how the body utilizes nutrients. Common cytokines associated with cachexia include tumor necrosis factor alpha, interleukins 6 and 8, and others. These cytokines promote muscle protein breakdown while inhibiting the synthesis of new proteins, ultimately leading to muscle atrophy. This is why cachexia is often seen in patients with cancer, where the tumor itself contributes to these inflammatory responses. It's important to note that cachexia is not merely the result of inadequate caloric intake. Patients may eat well, yet still experience dramatic weight loss and muscle wasting due to the biochemical and metabolic changes instigated by their underlying illness. In fact, cachexia can occur in individuals with obesity, as their bodies may still be in a state of metabolic imbalance. This makes diagnosis more challenging, as cachexia can manifest differently in different populations. The consequences of cachexia are serious and can significantly impact a patient's quality of life. Beyond physical alterations, cachexia is linked to fatigue, weakness, and an increased risk of complications from the underlying disease. It can lead to decreased physical activity and a downward spiral of health decline. Moreover, cachexia has been associated with poorer responses to treatment options in diseases such as cancer, as it can limit the effectiveness of chemotherapy and reduce tolerance levels for surgical interventions. Diagnosis of cachexia typically involves a combination of clinical assessments and medical history reviews. Healthcare providers may look for unintentional weight loss of more than 5% over 6 months, alongside signs of muscle mass depletion. Imaging techniques, such as CT scans or MRI, can also be utilized to measure muscle mass directly, helping clarify the scope of the patient's condition. Managing cachexia requires a comprehensive approach. The primary goal is to address the underlying disease while providing supportive care for the nutritional deficits. Nutritional support may include dietary modifications, use of supplements high in protein and calories, and sometimes even enteral or parenteral nutrition in severe cases. However, traditional nutritional interventions are often ineffective alone, hence, the need for pharmacological options. Several medications have been explored in the treatment of cachexia. One promising class includes anabolic agents, which are designed to promote muscle growth. Medications such as testosterone and its derivatives have shown potential, especially in elderly populations. Additionally, some studies have investigated the use of anti-inflammatory agents that target the cytokines responsible for the muscle breakdown associated with cachexia. There is also a growing interest in appetite stimulants that may help counteract weight loss by encouraging patients to consume more calories. Furthermore, exercise interventions are also being studied as part of a holistic approach to combat cachexia. Resistance training, even in small amounts, can stimulate muscle growth and strength. Exercise not only helps counteract muscle wasting but also improves overall physical fitness and quality of life. In conclusion, cachexia is a multifaceted syndrome with significant implications for those affected. It requires an understanding of its complexity and a tailored approach to management that includes addressing the underlying disease, nutritional support, and possibly pharmacological interventions. By increasing awareness and understanding of cachexia, we can better support patients in maintaining their strength and quality of life during their treatment journey. If you or someone you know is at risk of cachexia due to a chronic illness, it's essential to discuss these risks with a healthcare provider. Thank you for watching, and we hope this information has been beneficial. Remember to like, subscribe, and share for more educational content on health-related topics.